Hi, everyone. I'm Lucy Biggers, and I'm a correspondent for NowThis News based in New York City. NowThis is an online digital publication that focuses on young people. We reach 70% of people in their 20s each month online, making news accessible and relatable to young people. And this is going to be a great conversation today. I'm so excited to be here with Dr. Aaron Bernstein. He is the interim director at the Center for Climate Health and the Global Environment at the Harvard T.H. Chan School of Public Health. And Dr. Bernstein's research has looked at the connections between COVID-19 and climate change and how addressing climate change can also address and help prevent future pandemics. This is a very fascinating and timely topic. So Dr. Bernstein, I'm excited to chat with you today.
Great to be with you, Lucy.
So for background for our audience, what are the connections between COVID-19 and climate change?
There are a bunch of them. So we can start from the end of the mess, which is the actual pathogen getting into everybody. And we know that for people who've had to breathe more polluted air from burning fossil fuels, particularly in the United States, they're more likely to die. Burning fossil fuels are 80% of the climate problem. If we stop burning fossil fuels, we're going to prevent climate change and we're going to prevent people dying from COVID. And then you can sort of work backwards from that. We know that deforestation is probably 20% of the climate problem, and it's the major reason we see disease emergence. Now, we don't know exactly how COVID-19 got from probably a bat into a person, but we certainly know with Ebola, we can all remember Ebola, it wasn't so long ago, that West African outbreak. The evidence is pretty clear that it was deforestation in West Africa that led to that. There are many other outbreaks we've seen from deforestation. And there's just a lot of touch points in between that connect climate to COVID. And it turns out that when you look at the solution space, climate solutions are often pandemic prevention actions. So we can do these things and get win-wins.
And give examples of what would be prevention. You mentioned deforestation, so imagining preventing future deforestation would be one.
Yep, that's the big one. And just to be clear, it's not just that forests are important for preventing, keeping them intact from preventing pandemics and emergent diseases and for protecting the climate, but forests have lots of other value, whether they're here in New England, in other parts of the United States, or in the tropics. They're very important for water quality. They have real importance to indigenous peoples. So forests, big part of the solution set for lots of different problems. And then on the side of fossil fuels, I mentioned the air pollution piece. Air pollution in the United States is leading to the early deaths of like 300,000 people a year. So it's almost a COVID epidemic in the United States every year, but it matters to everybody's health. So the kids I take care of as a pediatrician, we know that air pollution is really bad for their lungs. It's bad for everybody's brains. And so we see these sort of mounting benefits. But critically, in all of these spaces, the protection of the environment has disproportionate benefits to those who've been most harmed in the past. Air pollution is a great example. Pollution and poverty are close bedfellows. We also see in the United States that people of color, particularly Black Americans, Hispanic Americans, much more likely to breathe polluted air. And so when we stop burning fossil fuels, which are the main source of air pollution for most Americans, we're going to see the benefits accrue to the people who've been harmed most in the past.
And that's such a good point, that the people that get hit first and worst by these global, whether it's global pandemic or global climate change, they're the same communities that are getting impacted. And would you argue that because there are so many parallels, that we can make a connection that COVID-19 is almost an environmental disaster?
There's no question that COVID-19 is an environmental disaster. If you look at emerging infections, these are the new things, whether it's COVID-19 or going back to 2003, SARS, Ebola, these diseases that, Ebola was new, but it's coming on strong. COVID-19 was totally new. These emerging infections are being driven by environmental trends. That could be because we're chopping down trees, or it could be because of climate change itself. Where I live in New England is sort of a home to Lyme disease, where most Lyme disease cases happen, but we see it moving north, and that's not by coincidence. We see every scrap of life trying to get out of heat. So running to the poles, running up mountainsides. And that doesn't just lead to things like Lyme disease showing up in new places. It means that animals are bumping into other animals that they never would have come into contact with because they're trying to get out of the heat. And that creates the opportunity for the movement, or what we call spillover, of a bug from one animal to another, and that can get into a person. So the tumult in the environment is absolutely about our health, and we have to make that clear. We can't afford to operate as if we can totally transform the environment and it's not going to come back and matter to us.
And it's another parallel to climate change where there's these feedback loops that you have, you know, once these impacts start getting felt, they get felt worse and worse and they speed up. But then at the same time, you know, there's a conversation around how developed countries, the US, where we're both from, like we got the chance to exploit our environment and develop it and do the deforestation thing. And now we're on a path where we're trying to reverse that. But how do we tell, you know, developing countries that they can't be, you know, developing and moving into forests? Or is there a way to do safe growth where they're having the economic growth, but then also not having these risks of pandemics and climate change? Is that something that you've looked into at all?
Yeah, it's a great and really, really important question, Lucy. So two quick examples. The first is Brazil. So Brazil, prior to Bolsonaro, actually had a tremendous reduction in loss of forest through policies that encouraged protection of the forest, through protecting indigenous rights, and a suite of actions for enforcement. And as deforestation rates fell, the income of farmers went up, not down. And so the economy did better because, of course, if you flood a market with goods, the price goes down. I mean, it's a very simple prevalence. In places like Rwanda, there have been research studies showing that as biodiversity is lost, poverty and disease are more likely. So we see evidence in scientific literature that when we protect nature, we protect ourselves and our economies. Sure, we can maximize short-term economic gain through chopping down vast swaths of forest. There's no question about that, but it doesn't last very long. And the evidence shows time and again that over time, these are self-destructive actions. And so we're trying to make the case, and particularly in the COVID era, that we simply can't afford to do more vaccines and tests, which, you know, we've got to do now because we've got a pandemic. We absolutely need to spend our dollars, whether it's in this country or around the world, at doing primary prevention, preventing these things from emerging. That really involves protecting nature and protecting the climate. These things are foundations of our ability to lead healthy and productive lives.
I love your answer so much because I think it kind of turns on its head this assumption that I kind of asked in my question, which was that we have to be sacrificing biodiversity and these spaces to have economic growth. And you're arguing that, no, that's just not the case. We're at a place now, I think, with our understanding of these systems that we should be protecting them. And you talk about, you know, preventing future ones. I think you're in your research, or in the research in this before this interview I saw, is it something like we can spend 2% of the cost preventing another COVID-19 than what we're spending on COVID-19 right now? What was that?
The math is really painful here because, you know, by conservative estimates, COVID-19 is costing us $10 trillion, maybe $20 trillion over several years. If you look at the amount of money you would take to protect forests, let's just look at the forest piece. There are other actions we should be doing too, which is addressing the wildlife trade and doing better surveillance for spillover. But a large chunk of this is deforestation. If you're doing that in the places where we have evidence that diseases are most likely to spill over in the world, which are in the tropics, and in forests that are the most at risk, you're looking at a price tag of like $20 to $30 billion. So, you know, 2% actually is an underestimate. It's actually a much smaller fraction of the cost. The challenge is that we have a hard time acting until after the fact as a species. And that's why pointing to the near-term health benefits of, in the case of climate actions, is so important because we can get our heads around that, right? So when it comes to fossil fuels, you know, there's a study out a couple of weeks ago out of Chicago, the closure of coal plants. Chicago is my hometown. There are coal plants that got closed because we put a price on the air pollution because it was killing us. And as those coal plants closed, children were less likely to show up in emergency rooms with asthma. There was a major drop. So people like me as pediatricians, we have less things to do, which I actually kind of like because my job is to keep kids healthy. And we see this, and parents get it, and children get it. You know, women who are going to be pregnant or are pregnant, they do better with their pregnancies when there's less air pollution. I mean, this is a big deal. And again, it benefits the folks who've been hit hardest historically the most.
That's so interesting. I think the best climate solutions are always the ones that are solving multiple problems at the same time. It's not just about less carbon emissions, like you're saying, it's better health, cleaner air, all of those things. And just to leave our audience with sort of something that they can take away from this, like, what's the biggest thing that you want to hit home around the connection between COVID and climate change? And is it something that we can all act on tomorrow or start talking about around the dinner table to get that message out there?
Yeah, it's that climate actions are pandemic prevention actions. And if we want to, if we want to get at COVID-19, preventing the next COVID-19, if we want to get at the health problems that are really most worrisome to us outside of COVID-19, whether that's obesity, mental health problems, Alzheimer's disease, dementia, heart disease, strokes, the climate actions benefit those diseases. And so to your point, we're embedded with fossil fuels. Fossil fuels have been immensely beneficial to us to date. There's no debating that. And we owe a tremendous amount to the communities in the United States and around the world that have made that possible. But at the same time, the science could not be clearer that we don't have a choice in terms of decarbonizing the economy if we want to be living healthy and productive lives. It's just not a choice. And so we have to protect the communities that provide us fossil fuels. We have to invest in climate solutions that are frankly what we should be doing anyway. The prescription I would write anyway, although I can't because you can't do this in a clinic office. We have to do it outside the clinic office to get us off of fossil fuels and to advance climate solutions are the things we would do to address obesity, heart disease, all these conditions. And that's really the fundamentally important thing here is we owe it to ourselves to care about ourselves and our children to take climate actions to improve health today.
Well, thank you so much. I learned so much from this conversation. I know that everyone at home did as well. So thank you. And yeah, this has been great. Thank you all. Thanks for tuning in.